On this episode of Putting Possibility into Practice, we're talking Intergy for pediatric practices. We'll discuss some of the functions that pediatricians use Intergy for on a daily basis, what their favorite parts are, and on the future of EHR platforms, what would you change if you were a pediatrician, and how do parents of patients use the Intergy functions as caregivers? Plus, we'll also talk with a pediatrician on a first-time parent handbook of which the practice developed and why it's a great resource and tool if you're expecting for the first time. This is Putting Possibility into Practice, and it starts right now. I'm Joe Augustinelli, Social Media Manager at Greenway Health, and I welcome you to this episode of Putting Possibility into Practice. We're talking about Intergy for pediatric practices, and I am happy to be joined once again on our podcast. We've talked to him on a few topics before, Dr. Michael Jordan of Eastlake Pediatrics with locations in Trinity, Florida and in Palm Harbor, Florida, correct?
That's right.
I know it by heart now. So welcome back to the podcast, Dr. Mike, and remind our listeners a little bit about Eastlake Pediatrics.
Well, Eastlake Pediatrics is the practice I started in 2004. We started actually with Intergy at that time, so I've been a customer for almost 15 years now. And we started as myself as the sole provider, and since then have expanded into 3 locations with 7 providers and serving either Pasco County, Pinellas County here in Florida.
And talk a little bit about Intergy and how you as a pediatrician and how the other pediatricians on staff use Intergy on a daily basis.
Well, from the clinical aspect, we use Intergy EHR, and it's ingrained in our daily lives as far as our record keeping. We try and be as efficient as we can with our note taking so we can spend time, with our patients rather than spending time, inputting data. We have several different features that we use regularly. One of my favorites is the predictive order management feature, which allows us to look at things that we've done in the past in case, we have a certain diagnosis that we've ordered certain labs for or certain charges are there. It kind of puts like all of our frequently used features or charges or referrals or labs into one space, and it makes it easy to be efficient when ordering new tests and things like that.
And how long have you been in practice and been using Intergy?
Well, we started with Intergy when we opened the doors. So that was in August of 2004. And as Intergy has grown and expanded, we've grown and expanded. And it's been a very kind of symbiotic relationship between us and the software.
And for pediatricians who may be considering Intergy moving forward, what would you tell them?
Well, I think, when you're looking for a practice management solution and an electronic health record, you want something that's going to be reliable. You want something where their support is eager to help. And you want something that's flexible so that when you're expanding or growing or something new comes up, you're able to adapt to that easily. And you don't have to worry about, is my EHR going to allow me to do this? You want something that has the flexibility to handle any situation. And I think Greenway has done a great job of making the product very malleable to whatever needs that we have in pediatrics.
And you talked about since 2004, so you've seen a lot of change in the healthcare industry.
Correct.
You've seen a lot of change in the technology and the product solutions. Going forward, what would you want to see in the next generation platform for an EHR and practice management solution that may ease some of the burdens that physicians have on a daily basis?
Well, I think, a couple of things that I'm looking forward to in the next generation of the software would be a more robust immunization kind of module. And I know they're working on that. They've recently added bi-directional feed so we can interact with the Florida SHOTS program, which does the kind of statewide record keeping. So that is very convenient, and that it allows us to download the records, and it also allows us to upload the records without having to do that manually. And there's also immunization forecasting as part of that module, which is helpful. But I think, with the new versions coming out, they've been working hard on expanding that module, and I'm really looking forward to seeing that. One of the other things I think would be very helpful for pediatricians is that, when we write for medications, a lot of them, or a majority of them, are going to be based on the child's weight. And so it doesn't kind of start and stop with, okay, this is the diagnosis, this is the medication, and then you kind of move from there. You have to say, okay, this is the diagnosis, this is the medication. Now I got to see how much of the medication I need to prescribe, what the dose is. And a lot of that stuff, for me, I think can be done behind the scenes. So for instance, if we had a medication, say for instance, that's like amoxicillin, if we wanted to treat for an ear infection, we have to use a different dose than if we were going to treat for like a strep throat infection. But if we could make a favorite where it says, okay, amoxicillin is going to be 90 milligrams per kilogram for each patient, then I don't have to go and say, okay, well, this patient now weighs 20 pounds, so what's the dose going to be versus the patient who weighs 35 pounds? What's the dose going to be? And if you just could be able to set that as a favorite, I say, okay, I just want to use amoxicillin. It does all those calculations ahead of time. It says, okay, this patient's going to need a teaspoon twice a day, and it's going to need 100 milliliters of that. That would save me a whole bunch of clicks as far as, ending the visit, because now I got to, okay, I got to do this or go through calculations. And then if I had a kid with strep throat, I could have a favorite for amoxicillin for strep throat. Okay, well, it's going to be a different dose. And if I just hit that, no matter what the child weighs, I don't have to think about it. I can just send it out. Mm-hmm. So I think those would be things that would really make my life easier. And I think they're very receptive to those ideas when I talk to people in development and support and things like that.
And when we talk about Intergy for pediatric practices, I mean, obviously it's a little bit unique because, for you and me, when we're at the doctors, we're taking care of our own medical records. We're seeing everything, whether it's on our phones or on our computers, but obviously different, in the pediatrician world because it's really the parents as the caregiver. So how have you seen the evolution of technology aid in maybe the care that parents are able to control over their child?
Well, I think a good example of that would be the kids that we see that have ADHD. Those medications typically are Schedule II medications, so they're very tightly regulated. And so, we have to see those patients frequently for checkups, and we can't call in those prescriptions. They have to either be handwritten, or now we're certified as the EPCS, where we can electronically prescribe controlled substances. And we've used that along with the patient portal to kind of tie things together so that our patients don't have to come in and pick up a prescription for a handwritten prescription for a medication. They can send us a message on the portal, and then we can send it electronically to the pharmacy. So that alleviates a whole process in the middle of them getting their medication for their child. And our parents are very receptive to that because, in the middle of the night, I forgot we need to get a refill. They can send us a message, and then we can electronically send it to the pharmacy. And they can just, after they send us a message, they can just go to the pharmacy and pick up the medication and skip the middleman of coming in here to pick up the prescription and send it over.
And speaking of parents, alluded to a little bit to it on the introduction to this episode, but your practice has developed a first-time parent handbook. Why don't you talk a little bit about this handbook? How did you guys develop it, and what can first-time parents find in that?
Okay, well, like I said, we started in 2004. So when I opened the doors, it was like tumbleweeds. There was just me and the nurse and the MA waiting for patients to come in, and eventually they came. But we had several months where we'd see a couple and this, that, and the other. So that gave us a lot of free time, and so we kind of accumulated these recommendations to try and come up with this project as a newborn handbook to make it helpful for new parents when they're having a baby. And so it's just kind of an introduction a little bit to our practice, and then it just has some helpful kind of tips and ideas about feeding and nutrition, development, breastfeeding, and I think it's been quite helpful. I've had people reach out to us from out of state, hey, we really like this, and our parents certainly have utilized it, And it's just something that kind of originated. So I had some stuff to do when we were waiting for patients to come in. And so we, try and keep it updated from time to time. We go through it and make sure that the recommendations we're making are still kind of up to date with the most recent data that's available. And it's been, I think, pretty successful as far as maybe helping parents answer some questions that, they don't have to call us for. This is, okay, is this normal, abnormal? How do I do this? And being able to have a document where they can go on our website and just pull it up, and they can it's a PDF, so they can download it or print it or do whatever they want. It's been a very, I think, a very attractive part of our website, and the parents really seem to like it.
And for folks who wanted to go ahead and download that document, your website address is?
It's eastlakepediatrics.com.
And in regards to questions, what are, perhaps the top 3 questions you hear from soon-to-be first-time parents?
Well, I think I was trying to think of, what would be something, that we hear quite frequently, because we'll do meet the doctor visits when the parents come in, they're new parents, or they're getting ready to have a baby, and they, a lot of times I'll say, hey, what do you guys have any questions? And they'll kind of look at me and be glassy-eyed, and I'll say, okay, how about if I just kind of tell you about stuff?
Yeah.
And they're like, yeah, let's do that. So I kind of go through kind of the way our practice works, what to expect when they're in the hospital, and then we'll get some questions from them that way. And a lot of times they'll be, okay, well, what's, do you think we should breastfeed, or what's the difference, or what is something that we should call you for, and we try and educate them. Okay, these circumstances, it doesn't matter what's doing, you need to call us. In these circumstances, okay, well, you can maybe handle this on your own. I think a popular question we get, and I don't know if this is somehow I'm getting roped into settling an argument, but a lot of times parents will ask, well, what's the temperature supposed to be in the house, And so I think sometimes we have, one of the parents wants it to be colder, one of them wants it to be warmer, and I'm the tiebreaker. So I say, well, the thing about a baby, it's not a snake. You don't have to go up onto a rock and sit in the sun to get warm. It's a warm-blooded creature. So, you want to keep the room comfortable, and, you have to be careful. You can't put them in the bassinet with a bunch of blankets and things like that. So I think, just use some common sense, and that way it kind of extracts me from the middle of that domestic issue.
Settling issues such as setting the temperature in the house, that's great. So, well, Dr. Jordan, I want to thank you for taking time to talk about Intergy and the First Time Parent Handbook. And reminder, if you as a listener would like to download the First Time Parent Handbook, you can visit the website www.eastlakepediatrics.com and download your PDF copy of the First Time Parent Handbook. Once again, Dr. Mike Jordan of Eastlake Pediatrics on this episode of Putting Possibility into Practice.
Thank you.
And for more information about Intergy for pediatric practices, I invite you to visit our website at www.greenwayhealth.com. And if you happen to like this episode of Putting Possibility into Practice, and we hope you did, feel free to subscribe to our podcast on your platform of choice. We are now on Apple iTunes, Google Play, Stitcher, TuneIn Radio, Spotify, iHeartRadio, and look for more platforms coming soon. I'm Joe Augustinelli, the social media manager at Greenway Health, and this has been another episode of our podcast, Putting Possibility into Practice.